Hey everyone, welcome to another episode of What the Dementia by Bamboo Care. I'm your host, Brianna Wilson. I'm a certified dementia practitioner and the founder of Bamboo Care. So, I'm not sure if you heard, but on July 31st, 2023, CMS, which is the Centers for Medicare and Medicaid Services, announced a new nationwide voluntary model called the GUIDE Model, which stands for the Guiding an Improved Dementia Experience Model and is for Medicare beneficiaries. Now, a lot of caregivers were interested in what this would look like for them and their partner living with dementia. So that's what we're going to talk about in today's podcast episode. And I think there was a lot of interest because when it was announced, it was emphasized that the focus of this model is to improve quality of life for people living with dementia, reduce strain on their unpaid caregivers, and enable people living with dementia to remain in their homes and communities longer and stay out of long-term nursing homes. But what I want to do is highlight what's going to be most important for you to understand about this guide model, okay? Before we get started, if you like the What the Dementia podcast, please be sure to give us a good rating to help other dementia care partners find our podcast. It would be super duper helpful and I would appreciate it so much. And if you would like to keep up with us between episodes, consider following us on Instagram at Let's Bamboo or joining us in our free support community at letsbamboo.com/champions, okay? All right, so the first thing that I want you to understand is that the guide model is a voluntary model test. That means that participants, which are the healthcare providers and organizations, can choose whether or not they want to participate in the guide model. Right now, CMS is accepting non-binding letters of interest, which is basically where a prospective organization says, hey, we think we'd be willing to try this model out, but don't hold us to it. Now, these participants have to be Medicare B enrolled providers and practitioners who are eligible to bill for Medicare physician fee schedule services and that provide or will agree to provide longitudinal care to people with dementia. And then these providers can partner with other providers and suppliers to help deliver services under this model, okay? So, why is this important to know? It's important to know because this means that you may or may not have a provider near you that will be participating in the guide model because it's completely voluntary. That's one. Two, this is an in the works kind of thing. Like I said, they are taking letters of interest until September right now, but there are no official provider applicants who have agreed to participate because Medicare hasn't released the official application yet. Does that make sense? Now, the next thing with the guide model is that this is not a proven model or anything. This is a, hey, we have an idea, let's see what comes of it. That's why it's referred to as a model test. The goal is to see if this model even works. Is it a tangible idea? So once they receive applicants, this model will start on July 1st, 2024 and run for 8 years. So let me go ahead and first tell you which Medicare beneficiaries will actually qualify to benefit from the services under the guide model, and then I'll tell you what those services include, okay? So in order to qualify, the beneficiary must be community dwelling and not in a long-term nursing home. So they can be at home or an assisted living facility, but they can't be in a long-term nursing home. They also have to have an official diagnosis of dementia, and that diagnosis has to be confirmed by a provider who is participating in the model. Of course, they have to have Medicare as their primary payer. That's to be expected, right? But here is the catch. They must be enrolled in Medicare Parts A and B, and they must not be enrolled in Medicare Advantage, which is Part C, including special needs plans and PACE. And they cannot be enrolled in the Medicare Hospice benefit, okay? Now, I was looking for some statistics because I was curious, and it seems that about 50% of Medicare beneficiaries are enrolled in a Medicare Advantage plan. Now, I don't know what percentage of those people also have dementia, but whatever the case, none of those people would qualify. So there's that. Now, under the model, here is the vision. There will be an interdisciplinary care team that will deliver the required services and make recommendations for service providers and community-based social services and supports while maintaining a person-centered plan. At minimum, the interdisciplinary care team must have a care navigator, which is someone who has received training in dementia assessment and care planning. So, this could be a community health worker, physician assistant, social worker. There's really no specific credentials required for the position of the care navigator. And then there has to be a clinician who demonstrates dementia proficiency as recognized by experience caring for adults with cognitive impairment, experience caring for patients 65 years or older, or a specialty designation in neurology, psychiatry, geriatric psychiatry, behavioral neurology, or geriatric neurology. Now, you and I both know that these types of experiences and specialty designations say nothing about a clinician's level of dementia proficiency. But nonetheless, these are the type of providers that you can keep an eye out for in your area that may choose to participate. But there will also be a full list of participants that will be released by Medicare sometime in the summer of 2024. So we will definitely keep an eye out for that. But like I said, a care navigator and a dementia proficient clinician at minimum. Now, let me give you an example of what it may look like if they partner with other providers. So it could look like a geriatrician and a care navigator partnering with an occupational therapy practice who can help with safety assessments and caregiver training, and then a home health agency that can provide in-home respite care services. Basically, the goal is to have a solid enough team so that the care delivery requirements can be met. So, what are the care delivery requirements under this model? So, first things first is that beneficiaries and caregivers will both receive separate assessments to identify their needs and a home visit to assess the beneficiary's safety. Then, a care plan will be established to address the beneficiary's goals, preferences, and needs. All beneficiaries and caregivers are to have 24/7 access to a member of their care team or to a third party representative using a 24/7 hour helpline. And this helpline has to be an in house creation. They can't just recommend you call the Alzheimer's Association's 24/7 hour helpline, for example, which, if you didn't know, the Alzheimer's Association does have a 24/7 hour helpline, and your partner doesn't just have to have Alzheimer's for them to be helpful, okay? And I will put that information in the podcast notes, okay? Then there has to be ongoing support. So the care navigators provide long term help to beneficiaries and caregivers so that they can revisit their goals and needs at any time. And I think the minimum requirement is for the care navigator to check in monthly, but don't quote me on that, okay? The next service is referral and support coordination. So the care navigator will connect beneficiaries and caregivers to community-based services and supports, such as home-delivered meals and transportation. Now, because I believe that you shouldn't have to wait for this type of information, if you didn't know, 211.org is a great place to start to locate local community resources. So you can dial 211 on your phone and speak to a live person for free 24/7. Or you can search on their website, which again is 211.org for local resources, okay? Next is caregiver support, which is actually for both paid and unpaid caregivers. But this is where the supporting unpaid caregivers language that is used to promote the model comes into play. And it's not what you may be thinking. So, caregivers will not be getting paid under this model, okay? Medicare is only paying the billing entity of the care team, not beneficiaries, not caregivers. That would be nice, right? But no, that's not how it works, okay? So, under this model, besides the 24/7 hour access that you will have to a care team member or to a helpline, caregivers will also receive free caregiver training and have access to support groups. Now, with the training, this is not standardized training. This is whatever the care team has arranged, so the quality and thoroughness will likely vary. And then some beneficiaries will qualify to receive respite services. What? Why only some, Brianna? Well, one, the beneficiary has to have a caregiver, but then two, the beneficiary must have moderate to severe dementia. So if your partner has early stage dementia, they won't qualify for respite care under this model, which I personally think is silly, but that's what it is, okay? And basically, how it will work is that the participant or billing entity will bill Medicare on behalf of the beneficiary up to a $2,500 cap for respite services. And then once Medicare pays them, the participants will then pay whoever they partnered with to provide the respite care services, okay? The next service is medication management. So, with this, the clinician will be reviewing and reconciling medication as needed, which is what any clinician that prescribes medication should be doing, anyways, but we know how that goes, right? And then the care navigators would be providing tips for beneficiaries to maintain the correct medication schedule. And then lastly, there's care coordination. So, beneficiaries are supposed to receive timely referrals to specialists to address any other health issues that they may have. For example, diabetes. And then the care navigator will help coordinate care with the specialist and make sure that everyone is on the same page. Now, the good thing is that some of the services that I mentioned will be able to be provided by virtual means. So, a visit to, let's say, the doctor's office won't always be required. You may not have to go to a certain place to receive your caregiver training, which can be really helpful if getting your partner out of the home is a challenge, or if getting yourself out of the home is a challenge as well. So, overall, for those who do qualify to receive services under the guide model, the surface level presentation of the model sounds okay, right? But I'm very interested in seeing how this plays out in real life and not just on paper. Many of us have experienced firsthand just how broken the healthcare system is. So, implementing this model within a broken system may be challenging, or at least interesting to say the least. I mean, physicians are already pressured to see patients within a 15-minute time span. Many clinics are profit driven at the sacrifice of quality care. Many physicians are already burnt out. More and more people already have to wait months to get an appointment with a physician. And if we're being honest, care coordination kind of sucks, right? Then, if we layer that with difficulty even getting a dementia diagnosis, I'm sure many of you have experienced the runaround or are still running around hoping for answers. This all makes for quite the situation, right? And now we are asking these same physicians to get it together, partner with others, and volunteer to implement this model. And not only implement it, but then on top of all the other duties required, someone on the team will have to be responsible for reporting the care delivery data, beneficiary and caregiver assessment data, socio-demographic and health-related social needs data, and then provide an annual report of quality data to Medicare. So it's a pretty big undertaking, and we shall see who is up for the challenge. And we will definitely know more about how this will look next year when the first programs start rolling out. So, like I said, it is an 8-year model test. The first group of participants will start their program July of 2024. These will be programs that already have a pretty established comprehensive dementia care program and just need to fine-tune it to meet the guide model requirements. And then we have the second group of participants, which will start their program July of 2025. So they will receive an infrastructure payment from Medicare to help with the upfront cost of establishing the dementia care program, and then they will be given a 1-year pre-implementation period. So that is why they start later, okay? So I just wanted to address the new Medicare dementia care model since a lot of people expressed interest in learning about it. But honestly, it's nothing that directly impacts any of you all right now. As we get closer and I learn more, I'll be sure to share any new findings or discoveries. I'll also post links in the podcast notes where you can learn more about the guide model directly from CMS, okay? So that is all for today's podcast episode. I hope that you found it informative and helpful. Again, if you do find our podcast helpful, please consider leaving us a review to help others find the podcast. If anyone has any questions, comments, or future podcast requests, remember you can always send us an email at podcast@whatthedementia.com. Thank you so much for joining us on another episode of What the Dementia by Bamboo Care. We look forward to catching you on the next episode. Take care, and until next time, stay strong, care on, and remember, you are not alone. Bamboo Care is always here.